Hello, everyone. My name is Rachel Funmalayo, and I am a registered dietitian nutritionist at the University of Iowa Hospitals and Clinics. I have been here for 6 years as a dietitian, and I am going to give you an overview of what it takes to be a dietitian and what it's like to be a dietitian. So what is a dietitian? What do we do? We are food and nutrition experts, and we are registered by the Commission on Dietetic Registration. So the criteria that they set out, the ethical standards that they write are what we follow. And they decide what credentials we need and what we need to fulfill in order to not only become dietitians, but maintain our registration, maintain our credential. So we're food and nutrition experts, and we work in a variety of employment settings, including healthcare, business and industry, community, public health, education, research, government agencies, and private practice. So within those areas, we typically break it down into clinical dietitians, community dietitians, and management dietitians. That's sort of like the major umbrella categories. So clinical dietitians provide medical nutrition therapy. They usually work in hospitals, long-term care facilities, clinics, private practice, and other institutions. They create customized nutritional programs based on the health needs of the patients or clients on how to improve their health through nutrition. They can further specialize in areas, and actually I'm going to go into that a little bit later. Community dietitians develop programs and counsel the public on topics related to food, health, and nutrition. They usually work with specific groups of people. So an example would be a school district. School districts have a dietitian working on the school menus, what needs to be fulfilled as far as the requirements from the USDA and the government, and how to achieve that. So the dietitian helps to achieve that. Or if you have children who have special dietary needs, the school district dietitian would help with that. Another example would be like a prison. We have dietitians in the prison system for inmates, and WIC is a huge one that employs a lot of dietitians. So women, infants, and children, they're required to have dietitians meet with the families and assess them. So those are some examples of community management dietitians. They typically work in food service settings such as cafeterias, hospitals, prisons, and schools. There's also management dietitian and community dietitian. You can have some overlap, sorry. You can have overlap there. You can also have overlap between clinical and management if you have a clinical dietitian who is overseeing all of the clinical dietitian duties. Anyway, so management dietitians in schools as well too. So they might be responsible for buying food, carrying out other business related tasks such as budgeting. There is a lot of finance in management dietetics. They may oversee kitchen staff or other dietitians. So that's kind of an interesting one too. So what are the requirements for becoming a registered dietitian nutritionist? This is actually a really interesting question because As of January 1st, 2024, the minimum degree requirement for eligibility to take the registered dietitian examination will change from a bachelor's degree to a graduate degree. So I graduated with my undergrad in dietetics in 2013. I went directly to an internship, and so I graduated from the internship in 2014. So I'll be grandfathered in along with other dietitians, but anyone new who's coming in has to now complete a master's degree. So that is the huge difference in this field, and I believe it, well, the Commission on Dietetic Registration made the decision to elevate that education level because it's more consistent with the knowledge, skills, and research base that's required to actually practice and carry out the duties of a dietitian. In addition to the master's degree, dietitians have to complete a dietetic internship. So that's what I had mentioned, that I graduated from that in 2014. And every internship is different, but they all require 1,200 hours of supervised practice. And they're all accredited by the Nutrition and Dietetics, the Academy of Nutrition and Dietetics. And then in order to maintain your credential, you have to complete 75 hours of continuing professional education credits every 5 years. And then you also have to maintain your licensure within the state that you practice, and they might have other requirements. So it's definitely a field where you have to keep up to date on the latest science in order to really be effective and maintain, to be able to say you're an expert. You have to keep abreast of all of the new research. So what would you actually study? If you do an undergrad in dietetics, you would likely have anatomy, physiology, biochemistry, statistics, epidemiology, microbiology, food chemistry, food service systems management, business psychology, nutrition in the life cycle, which basically just means nutrition at every stage of life, and medical nutrition therapy for different disease states, learning about what every organ in our body should do, and then what it might do when it's not working properly, and how nutrition relates to that. Chemistry, organic chemistry, animal biology or zoology, communications. So it's actually a pretty well-rounded coursework. The U.S. Bureau of Labor Statistics has come out with mean salaries for dietitians. So the annual wage median is $61,270 as of May 2019. And there are a lot of different variations depending on which area of dietetics you go into and where you live, where you practice. But the really interesting thing about this field is that it's growing much quicker than other fields. So the Bureau of Labor Statistics says employment of dietitians and nutritionists is projected to grow 8% from 2019 to 2029, much faster than the average for all occupations. In the recent years, interest in the role of food and nutrition in promoting health and wellness has increased, particularly as a part of preventative health care in medical settings. So what I think is really interesting about this field is that more things are going more towards preventative medicine. So being proactive instead of reactive. So it's really cool to be able to play a part in that. And it's nice to know that you're entering a field that will only grow, and there'll only be more opportunities for employment Okay, so skills that are needed to become a dietitian: analytical skills. We have to keep up to date on the latest food and nutrition research, like I had mentioned before. Compassion. Um, it's something that a skill that grows a lot when you've been a dietitian for a while. But you just have to be empathetic to other people because everyone has a different situation. Everyone's goals are different, everyone's battles are different. You get exposed to just a lot of different kinds of people, ready and not ready for different changes in their life. So having compassion will help them reach their goals. Listening skills, definitely definitely do more talking or do more listening than talking as a dietitian. um, Organizational skills. So I think that's really important for any field, certainly, but especially if you go into management with dietetics or private practice. Uh, Problem solving skills. So this is kind of a big category, you know, goes along with critical thinking skills, especially with clinical dietetics, which I'll talk more about in a while. But in order to work with your care team and come up with the best plan for your patients and clients, you really have to be good at problem solving. Speaking skills. So we do have to explain very complicated topics to people who need a very simplified form, um, because they're not experts or they might have a different education level. So being able to break things down into what makes sense for the average person, um, when you're talking about really complicated things, is important. So you can specialize in a lot of different things as a clinical dietitian. I did want to talk about clinical mostly because I'm a clinical dietitian. I'm a pediatric nephrology dietitian, so I um, work with kids who have kidney disease. Um, so within clinical dietetics, you can specialize in a lot of different things, such as oncology, just cancer, pediatric nutrition, which is what I do, renal nutrition. You know, obviously there's some overlap. You can do adult or pediatrics for renal nutrition, sports dietetics, and several others. So I just laid out a couple questions that I thought were important. What is your favorite part of your job? Um, for me, I think you'll get a lot of different answers from different people, but for me, being able to take care of kids and feeling the parents' appreciation of me is my favorite part for sure. That's really rewarding. Um, it's definitely emotional, but when you do a good job and the parents are really thankful, it's a beautiful thing. Least favorite part. So you are definitely at the mercy of many different providers, schedules, personalities, timelines, expectations. I, for example, report to 5 or 6 providers, and they all have their own set of patients. Um, so there's a lot of demands, a lot of navigating those relationships, not only with providers and doctors, but nurses and um, other members of the multidisciplinary team. So it can get challenging just trying to serve all of those people. I mean, ultimately you're serving the patients, but you have to be able to work with everyone to be able to do that. So that can get challenging. Um, what is one thing about your career that you wish you knew before you started? This was a fun one for me to think about. But you know, not taking things personally would be advice that I wish I was given, because you definitely have a lot of days that they're super emotionally tough because you take your work personally. Not everyone's going to respect you, appreciate you, you know, and it's going to take time and energy and selflessness, not selfishness, selflessness, and work in order to gain the respect of other team members and families. So just that learning curve, it would be nice if someone gave me a heads up about that. And I do believe that's probably true of any profession. That's just what I've experienced. One thing my career has taught me, you make an impact when you believe that you can. So everything is what you make of it, especially in this field. I think you can get by just fine doing the bare minimum, but it's when you push yourself out of your comfort zone and you really go above and beyond that you get something back from this career. And again, I've said this for probably every question, but it's super similar for probably all fields. This is just what I've experienced in dietetics, is that you really get out of it what you put into it, and you make it your own. And because there's just so many different settings to work in, and so much to know, and always so much that's changing, I think, with any healthcare field. But yeah, you get out of it what you put in. An average work day for me, I do a lot of documentation in our electronic medical record in Epic. I do a lot of talking with team members, physicians, nurses, in some cases other dietitians if we have mutual patients. I do a lot of talking with parents, with kids. I talk on the phone with parents. I see patients every day, inpatient and outpatient. I spend time in multidisciplinary inpatient rounds. So we go up to the floor and we have a group of doctors, residents, social work, continuity of care, myself, all representing our own expertise for this patient. We go to their bedside, talk to their family, talk about the plan for the day. So what I would do in that case is usually talk about changes that we need to make for their tube feeding. A lot of our work as clinical dietitians is to manage tube feeds when patients do not eat normally. So I'd be talking a lot about that in rounds, and evaluating labs and big picture medical status and all those sorts of things. A little bit of algebra, cross multiplications, my friend. We do a lot of interpreting growth charts and some special projects in there, lots of problem solving. You might have an idea that you want to do for a patient, but you might get several other ideas within the group, or you might get pushback from families. Every single patient is so different. So no day is the same. Literally no day is ever the same. And I think that's a good thing. I would say most of the time that I spend is direct patient care, either direct patient care or charting on the electronic medical record, and documenting those encounters with patients and forming my recommendations. So I would say a lot of time on the computer and a lot of time with patients. And then probably in the last 5 years in dietetics, nutrition focused physical exam has gotten to be a bigger part of our profession. So we physically touch the patient, we assess them for anemia, We look at their skin, we look at their hair, we look at if they have water retention. We assess them similarly to what a physician would. So that part of our day might be spent doing that, especially if we have really sick patients. We might do that, or a new patient that we're just meeting for the first time. So that's kind of what my day looks like. For any additional information, I would either go to the Academy of Nutrition and Dietetics website or the Commission on Dietetic Registration. And then, of course, if you feel comfortable, I'm happy to answer anyone's questions. You can feel free to email me directly. So that's all I got. Thank you for listening.